Hello, and welcome to the ASCA Audio Update. My name is Charlie Leonard. I'm a member of the ASCA Public Affairs team and host of this recording. I'm joined today by Stephen Obresh, ASCA's Assistant Director of Government Affairs and ASCA's Chief Point Person on state government issues of interest and concern to our Surgery Center members. I've asked Stephen to join me for a quick update on some of the state-level issues that he and several state associations are currently monitoring around the country. And while the issues we will talk about may be specific to a handful of states today, it's not uncommon to see policy ideas spread from state to state or even to the federal level. And that's why we thought it would be worthwhile to have Stephen report on some of the highlights of what he is seeing and hearing around the country. Stephen, welcome.
Thanks for having me, Charlie.
Stephen, before we jump into some of the state-level issues you're tracking, I think it'd be worthwhile for you to take a moment and explain how you gather this information across 50 states, and more particularly, the working relationship that you have with so many state leaders and state associations, and the mutual benefit that accrues from those relationships.
So in my role at ASCA, I am using primarily tracking software to keep up with what's going on at the state level, both legislative and regulatory. Last look, I think we're at about 600 bills that we're tracking across the states during the 2023-2024 legislative session. And that, of course, isn't the only way. And as you mentioned, we have a very close working relationship with the existing ASC state association, and that plays a crucial role in my ability to do my job well in terms of just getting really important on-the-ground feedback. They know the political personalities, they know the landscape all of this is happening in, and getting that feedback from them can help our advocacy efforts be much more effective. So we work together. ASCA often provides talking points, research. We sometimes provide testimony to the state associations as they're working on advocacy projects. And in return, we see a lot of support from the state associations for things like our federal work. So it really is a two-way street.
Okay, I know there are 4 states with very distinct issues that are of concern to you today. Let's take them one at a time. Why don't you start with North Carolina, where legislation is pending that could limit facility fees? What can you tell us about that proposal?
Yeah, so HB 681 is the bill in question here, and this originally started off its life as a measure dealing with interstate medical licensure compact. The gist of this language is that it would essentially prohibit any hospital-based facilities, which is defined in a way that it would include joint venture ASCs, but it would prohibit those facilities from charging facility fees for the services provided there. And as we know, ASCs cannot survive without being able to charge those fees to fund their operation. So we're watching this one closely. As I said, they did this to a bill last year. Thankfully, the House has acted as a bit of a backstop, and we're working with stakeholders in the state to ensure that happens again.
Okay, let's move on to California, where I lived. Our state legislature here is considering legislation that would affect the acquisition of ASCs by a hedge fund or a private equity fund. Can you tell us about that?
Yeah, so AB 3129 is that piece of legislation, and this measure would authorize the Attorney General in California to consent to, give conditional consent to, or not consent to a change of control or an acquisition between a private equity group or hedge fund and a healthcare facility or provider group. This is kind of a trend we've been seeing across the country. There's been a lot of focus the past 2 years on PE and healthcare. California has kind of been chipping away at this over the past couple sessions, and a lot of the chatter we're hearing is that this is probably the most serious effort to date. I know the State Hospital Association is active opposing the measure, and I know the State ASC Association is watching it closely, as are some of the management companies that we work closely with. They're very invested in seeing this resolved well in California.
Okay, thanks for that. In Massachusetts, which is a certificate of need state with respect to opening new healthcare facilities, I understand the legislature there is considering amending their current requirements. What have we learned about that proposal?
This is an interesting one, and House Bill 4653 is currently the vehicle for this language. What it would do is codify the state's current CON regulation into statute, with the notable exception of the grandfather clause that currently exists for ASCs that were licensed on or before January 1st, 2017. And under current regulations, those ASCs are exempted from having to obtain a CON for a number of different activities like expansion, change of ownership, things like that. But this legislation would remove it. And I've had a lot of conversations with the Massachusetts Association on this one. The general sense is the House Speaker was pushing this. And at the heart of it, it seems to be this belief on the Speaker's part that ASCs bear some responsibility for the demise of hospitals in the state, which I feel pretty comfortable saying just is absolutely untrue. Massachusetts is one of the most difficult states to develop new ASCs in. Even looking at their CON applications, only 2 new ASCs have opened since 2020 in the state. So really, the state association is deeply concerned because it's already so difficult to develop new ASCs in Massachusetts or expand existing ASCs.
Last, I know you've also been tracking a proposed set of regulations in South Carolina that would establish licensure requirements. What's the latest on that effort?
So very near the finish line in South Carolina. And this actually grew out of CON repeal reform that happened in South Carolina last year, where the state essentially did away with almost the entirety of its CON program. ASCs included, ASCs in the state are no longer subject to CON requirements. And there are some important differences from what ASCs in the state have operated under previously. And some of the big notes here are for charity care requirements. Bit of a trend we've seen, especially in the South, as states have reformed their CON programs, they often impose charity care requirements on ASCs. So the state will be imposing some increased charity care requirements on ASCs established or constructed after May 15th, 2023. They'll be subject to these increased charity care requirements. And all ASCs will now be subject to a transfer agreement requirement, which South Carolina previously didn't impose.
Okay, well, very serious issues across the board here. Keep an eye on. Stephen, thanks for taking some time to speak with me and provide these important updates and insights. I'm sure we can count on more updates in the next few months.
Absolutely. Looking forward to joining you again.
Okay. Before signing off, I'd also like to take this opportunity to remind anyone listening that ASCA's long-form member survey is currently open. And if you haven't already done so, we strongly urge you to complete your survey. Your answers and feedback play a central role in the adoption of ASCA's strategic plans. So you'll want to make sure your voice is being heard when we assemble the results. Now, before concluding, I'd also like to acknowledge the support of our update sponsor, AmSurge, a leading ASC management company, more than 250 ASC partners in 34 states. To learn more, visit amsurge.com.